Hello and welcome to another episode on healthcare in India. We are discussing COVID-19 crisis and how it has exposed the fault lines and how we can improve those. I'm Sukant Khurana. With me is my friend, the co-founder of IonCure, Dr. Raamesh. With us is Dr. Dipasri Konar, an epidemiologist, practicing physician and a scientist. We have with us Dr. Sharath Krishnaswamy, who's an anesthesiologist and also a brilliant science communicator. They've all been collaborators of mine. So I'll move over to sort of Dipasri. Dipasri, you are right now working in tribal areas of Chhattisgarh. So what has been sort of your experience with the COVID-19 crisis?
So hi everybody, and thanks Sukant for the introduction. More than an epidemiologist, I'm a microbiologist and I deal with infectious diseases, clinical microbiology. I do some epidemiology. Now, as you said, I am working in Chhattisgarh, which is one of the poorest states in India. And I am working in a tribal area. It's a rural hospital. Most of you will never, maybe in your lifetime, come here. You might never find it in the map. So at the best of times, we do not have, leave alone state of art. We do not even have we would say a good healthcare system that every citizen in the country deserves. We have severe limitations and we are just trying to do our best out here. So the COVID-19 has hit the country badly, and even at the best of times, we did not have a very good healthcare system. We did not invest in it. Now everything is falling like a pack of cards. And we have only ourselves to blame because we have never taken healthcare seriously. Here as a physician and as a clinical microbiologist, I can see that the patients are suffering, the people are suffering due to two reasons. One is the measures that were taken. The pandemic itself has hit us, everybody hard. The measures that were taken were somewhat ineffective, and also we are not doing I would say a uniform good job as far as detection is concerned.
So what is the status of what is the status of PPEs and testing kits in your area?
We have been fortunate to have received some PPEs, which is enough for now because there are very generous people. This is from individual donations mostly. We have got some from the government, but mostly from the individual donations of donors who have been who have shared their goodwill with us. And I don't know how long that will last, but yeah. So at present we have even more concerns than the PPE. As everybody, we will reuse PPE if it comes to that. But the other concerns are here. What I see from my patients is the lack of public transport has hit them very badly. These are people. So I don't know if the rest of the country is aware that we have 33% tribals in this part of the country, in the state. And they are among the poorest of the poor. If they don't earn, they don't eat on that day. So there's no way that they have saved money for 4 weeks or 5 weeks of lockdown. There is just no way. So these people depend on public transport to come from the interior most of the jungles to the hospital. And that public transport is not available. So after the lockdown was lifted for some days, we saw the worst of the TB patients. There was a surge. They were waiting till days on end to come over here. Some of them had to sell off some sort of property or jewelry, whatever, to pay for private vehicle to come. Uh, and so there are other diseases which suffered a lot. Most of all tuberculosis, because people were sitting at home for 8 weeks before coming over here, and they came in real bad shape. So yes, COVID is here. The whole country is fighting COVID. We are too, but we have no testing like kits in our hospital. So I cannot, even if I see a patient and I see that this patient has all the symptoms of COVID, I cannot take a swab. I don't have a swab. So I have to refer the patient to Bilaspur, which is the nearest testing center. Now, what happens is that due to our weird guideline that we have no community transmission, the most important thing, it seems, for testing centers, at least in Bilaspur, is that whether they have got a travel history. And of course, we know that there is community transmission. So if these people cannot give a travel history which fits the bill, then they are not tested. They are not tested. Even if they have fever, they have shortness of breath for 2 weeks or 1 week, they're just sent home with some supportive care. So we have to pretend that they did not they were not infected with COVID.
So COVID-19 numbers that way are being drastically underreported. And secondly, you fundamentally have so many other diseases. I mean, there are people dying of tuberculosis, other infectious diseases, and biggest problem of all, I mean, hunger. Then there are...
So, yes. So here people die of hunger every day, and hunger is a medicine for them. I mean, food is a medicine for them. Sorry, I mean, food is, for us, it's like, for some, it is luxury we can go out, eat whatever we want, but for them, it's like without food, sometimes they're in such bad state that if they have to buy food, they don't get medicines. Now the government is providing them rice, I understand, but there's no pulses, no vegetables, because the supply chain has broken. So imagine you having to eat rice and salt every day. That's not a meal that anyone should be having. Yes.
Yeah, and that is why
on the
I mean, on that note, so that is why when people say that you are working on supply chain and healthcare, how do they tie together? They exactly tie together. Healthcare doesn't work in isolation. I mean, there has to be an integrative approach, and that's why we were even previously, Raamesh and I were discussing why even we work on awareness, right? So healthcare is not just about finding a new medicine or finding a new equipment. Yeah, go ahead.
Yes. So think about the quarantine centers in the country. We are all hearing people running out of the quarantine centers and like, why did they run out? They are spreading COVID and whatnot, as if they are criminals. If you put 200 people in a small quarantine center, they don't have breathing space. Of course, they're going to run away. I would run away. Here, the temperatures are going up to, it was 48 today. It can go up higher. Imagine putting them in a quarantine center with no coolers. Sometimes the fans work, sometimes they don't. And you expect them to stay over there. I mean, overcrowded, quarantine centers, how can and I have heard people saying that they are used to all this. At home, they don't have electricity, so they don't expect it. No, they are human beings. You don't do that to them. I mean, if you're putting them in a quarantine, at least let them live like human beings. And this is everywhere in the country. The migrants are coming and they are putting them in schools with no toilet, like inadequate toilet facilities. We know how the government school toilets are. It's not nothing new. And then you just put them on like animals. That's not how it works. It's not supposed to work that way. And then regarding the testing, in our country, in the government hospitals, a lot of which have been in designated testing centers, so many people have never even done any PCR before. And suddenly they are asked to rise to the occasion. They don't know the science behind it. They don't know, what's going on, how important their work is, how everything has to be just perfect to get the result, how important. So the ICMR has provided guidelines, but sometimes the samples sent are not collected well, are not transported well, are transported not even in viral transport media. They just stick it in normal saline and send it. There is just no, the idea that how important everything to be perfect is, the idea of biohazardous samples being sent in triple containment is not there. So these people have never done PCR before. I know they had to rise to the occasion. I know it's difficult for them, but I think there has to be. I know of people. I know of situations where it has to be discarded, but they were not adequately sent. So these are some of the problems.
So one important thing you pointed out, so I think when people say there's shortage of instruments, sometimes, in fact, there is excess of instruments and not enough expertise. Because money is allocated in government, even research institutes. I'll give you an example of the Drug Discovery Research Institute, CDRI, where I work. The final instrument everything didn't even arrive end of 3 years. And second year, when there was even discussion on whether I should continue for one more year, they said the instrument arrived a year ago. It had arrived a month ago. And some of the remaining things took forever. And that's the state of art in main research institutes of India. You can imagine what the status will be in a hospital. So if there's budget, people will buy PCR equipment. Again, I'll bring up research institutes. I found equipment with polythene over them. They were not even opened, right? So if there's budget allocation, people buy stuff. They buy stuff because there's even a cut. So people, if somebody is buying instruments worth 5 crore, they end up making 50 lakhs out of it. That's why they buy it. And the instruments keep rotting. So just because you have instrument and not enough expertise and not the whole ecosystem to use them, they are worthless. So a lot of money in hospitals, in government hospitals, gets wasted that way. I think this system, not in Chhattisgarh, but has even exposed how many ventilators don't work, right? I think more than 50% of ventilators which were sitting around in government hospitals, which are crucial, which are not research material, which are meant for patient survival, they don't work and they're lying around. Such is a horrible state. And then we saw.
We have 739 districts in this country.
Yeah.
Can we not get 739 people, scientists who do PCR day in and day out? That is available. That expertise is available in the country. Just designate them to each district hospital. Let the people learn from them. Let them, teach and mentor them. It's not so difficult.
Absolutely. So can we do one thing? Can we let in Dr. Ravi Nair in this conference call? Is he joining? Let me introduce Dr. Ravi Nair. Has been trained in UK. He's worked in France for several years. He's worked in London as well as in Scotland, in Edinburgh. Ravi Nair is the academic head of Healthcare Global, one of the premier hospitals of India, based out of Bangalore. What we have been discussing so far is how COVID-19 has exposed various healthcare problems of India. And Dipasri discussed a lot of issues of Chhattisgarh, where TB patients were not able to access any transportation, and when they came, they were in really bad shape. So if it is poorest of poor. Now, how is the situation in Bangalore? I introduced our audience to you that you are currently based at HCG, and so you are coming from one of the most premier hospitals of India.
So the healthcare challenges are on many fronts. The first front is that the medical community itself is a little unsure as to the realities of the disease. This is not a fault, but this is a consequence of lack of proper knowledge. And knowledge is still accruing. Like at one time, chloroquine was touted as the solution, and then it was condemned, and then it's coming back gradually, so on and so forth. So there's lack of strong evidence of treatment guidelines. There's lack of strong evidence of outcomes. That is at a medical level. At the public health level, there is lack of clear-cut guidelines as to the role of lockdown, the methodology of reopening, whether or not there is community, like you talked about community spread, testing kit short.
Yeah. So Ravi, I think.
And sort of confusion, if I may use the word, because of widespread knowledge, correct or incorrect, being disseminated by the internet. People tend to panic, and that is understandable. Even many doctors' sources of information are the internet. There are a lot of publications coming out, scientific publications, which are prior to peer review. Now, scientific publication prior to peer review carries its own risk, because peer review may invert the thing, might invert the science. So you're basically groping in the dark. Treatment, therefore, has fallen down to common sense, in the sense that if there is a respiratory difficulty, you give oxygen, you give ventilation, and you're following standard norms. There is no way out of this cloud except if you keep scientifically accruing information, understand that the treatment is not a magic wand, try to bring back basic discipline. I think the countries which have done well have been countries which are basically disciplined. The problem about India is that there are many Indias, and Dipasri will agree that India or Delhi requires a different method. The India of Kerala requires a different method. The poor India and the rich India and the intermediate India, you cannot have one treatment for all. The policy makers often decide policy depending on where they come from. So if you have a policy maker who comes from an upper middle class family, he's largely going to look at it from that perspective. He will think about flights. If you have a railway minister who actually travels by train, then you would have figured out this difficulty of having these special trains for the workers and people dying in the. So if you ask me what challenges, the challenges which we face are largely the challenges of society, and largely the fact that we are a society which is indisciplined. And exerting discipline from outside often causes a reaction. It's not that everybody follows it. So side by side with corona specificity, we also, in my opinion, need to look at societal issues. We need to look at ways of lowering the gap. Just to give a casual statement, which I may regret, Dharavi should not exist, but it exists. And it is your main source of issues in Bombay. I mean, anybody would realize that Dharavi is an eyesore, and that clearing out Dharavi would be a fraction of the cost which you are spending in big mega projects. But it would go a far longer way to control these kind of illnesses than anything else you do in Bombay. So I think a little bit of common sense clarity is what is needed. Like personal protection devices, distancing and all that. If you see, this has been the persistent refrain. These are common sense, but they are currently the only way you know how to get out of this hole. And you just have to pray that active research is being done to find cures, to find ways of mitigating. One last comment is that Indian healthcare has been found wanting because there is no research being done. Research is not being actively supported in India. Governmental mechanisms are tuned to saying no. Governmental mechanisms are not tuned to helping. This is a fact. Second, medical colleges, academic institutions have been exposed because world over, academic institutions are taking the lead in research. In India, a few smattering of major institutions are getting funds. A few smattering of private institutions are pushing, but there is no cohesive research being done, and that is a tragedy. I think that's about enough.
Yeah. So thanks, Ravi, for those insights. Having been in India's research apparatus for 6 years, I can tell you it's mostly money wasted, unfortunately. So India's research apparatus obviously needs an entire restructuring. Very useful insights we couldn't have had from anyone else. So thanks for joining us. We'll be coming back with other episodes, trying to get other physicians. And Ravi, if you get time some other day, it'll be really useful. We'll continue on with our series on both COVID-19 and in general on healthcare in India.
So thanks a lot and nice meeting you, Dipasri.